Joining us now, Matt Jacob. Matt, you're our expert on this topic here that's been kicking around town an awful lot. Let me throw you some stats, and I want you to react here. Meadville Medical Center, as part of our needs assessment, looked at what's causing people to be sick, what's causing them to have medical problems. The number one reason for several years in a row why folks went to the emergency room at Meadville Medical Center was a toothache, was oral pain. Is that normal? I mean, I only work at Meadville Medical Center, so I don't get out to lots of other hospitals, but is that normal?
Well, there are a lot of hospitals and medical centers that report dental being in the top 4 or 5. That's probably a little on the high side compared to most hospitals, but it is a problem in many areas of the country. And some of that is access, where individuals don't necessarily have dental coverage, and so they're going to put off seeing a dentist when they feel they can afford it. And unfortunately, at that point, frequently it does become an abscessed tooth or a toothache, and they've got a serious oral health problem at that point.
So Meadville Medical Center's reaction to that was, at a big expense, a big effort, was to start the Meadville Dental Center to give folks a place to go. We had a lot of folks in the Meadville area who were covered by medical assistants who really didn't have an option, didn't have a place to go. So I guess it was what you were saying, of an access shortage or an access problem. So now, in the years that have transpired since then, we have gone from 100 visits the first month whenever the center opened to close to 1,000. The average, I think, is 850 or 875 or something like that a month now. But still, it's in the top 10 of reasons why folks are going to the ER. So is that normal? Yeah, we can't solve that whole problem.
Right. It's a stubborn problem. We know that people are much more likely to have medical coverage than dental coverage. Some of this goes back to historical factors that drove this decoupling of medical and dental, to where even if you are employed full-time, you may have medical coverage, but your employer might not offer dental coverage. And so that's a real issue. And in some ways, that's playing out nationally. Congress is debating what kind of changes, if any, should be made in the Affordable Care Act. That is one act that gave people access to purchase dental coverage either for themselves as adults or their children if they have kids. But it is a real issue, and I have to say I commend your hospital, your medical center, for taking that affirmative step, because most hospitals, if somebody shows up at the ER, there is no embedded dental clinic where they can really receive the kind of care they need. They would have to be referred out, or they would be told, sorry, we'll give you this pain medication, but they're not going to really be able to address the underlying problem. They'll tell them, oh, just go see your dentist, follow up with your dentist. Well, that's great if you have a dentist, but if you don't have a dentist
Exactly. My next question to you is, okay, so you come to the ER, and the ER, we're going to check you for everything, because there's lots of lawyers out there that are twisting everybody's arm, and you're going to get a CAT scan, you're going to get a bunch of tests, and everybody's going to run up a bill that maybe doesn't need to be run up because there was no alternative. Okay, so now there's an alternative, but the problem isn't gone. To me, it's an upstream problem, and we have a fair number of low-income folks who probably aren't in the position to afford to do fluoride rinse for their kids and all those kind of things. Let me just throw you that one generically. Is what's next? What's another option?
Yeah, we do have to think more upstream. We want to get to people, children or adults, long before they complain of any kind of pain, long before we can look inside their mouths and say, looks like there's some signs of decay. And so that means prevention with a capital P. And that takes many different forms. It takes counseling, not only from dentists, but pediatricians. We know that moms and dads take their kids to see a pediatrician in general long before they're going to see a dentist. And so a pediatrician, many of them are now starting to at least make some brief comments, look inside the mouth, say, hey, have you thought about taking your child to a dentist? A lot of parents don't realize that their first dental visit should happen for a child by their first birthday. So just trying to raise that awareness is important as well. They may apply fluoride varnish to teeth when children are young. Fluoride comes in many forms. Fluoride toothpaste is very important to use twice a day. Not every single kind of toothpaste on the market has fluoride. And then, of course, a lot of communities here in Pennsylvania and across the nation have water that has added fluoride. Fluoride's a mineral that exists naturally in water supplies, but most communities do take that extra step of saying, hey, let's add a little bit more to get to that level that's been shown to reduce tooth decay. And so all of those forms of prevention are really complementary. The goal is to keep enough fluoride inside the oral cavity, the mouth, throughout the day so that it's mixing with saliva and bathing the teeth over and over.
Okay. And so getting it through, internalizing it. Well, let me ask you the question that I hear from folks, or question or comment. Let me think how to say that. But, oh, it's going to create other hazards for me or for my kids. Talk about that for a sec.
Well, there are a lot of things on the internet, if you search fluoride, that raise concerns. Virtually every one of these have been researched at some point or another. When people raise concerns and the medical and scientific community feels there could be some validity to that, they've been very diligent about researching it. So a few years ago, for example, there were some concerns raised about IQ scores. My goodness, there were some studies from China, and they suggested that fluoride could be linked to lower IQs. The health and medical community took that very seriously. New Zealand did a very exhaustive study. They followed people over a 38-year time span.
Wow.
And took multiple readings of IQ just to assess, were their cognitive skills improving or deteriorating depending on where they lived. They found no association between people living in a fluoridated area versus not. So that was one thing. I think the other thing that's important for us as consumers of information is to kind of scratch beneath the surface and learn as much as we can about the original research. A lot of those studies from China were based on the fact that they have a lot of rural areas in China with extraordinarily high levels of fluoride, 5, 6, 7 times more fluoride than the typical community in Pennsylvania has. So it's just important for us to know that.
I heard recently of a change in some towns in Western Canada. Edmonton, I think, was one, and was it Calgary? One had fluoride, and one decided to drop the fluoride out. Am I saying that right?
That's correct.
Well, what happened? I mean, I've heard, summarize that whole thing, if you would.
Yeah, so in Alberta province, the two largest cities there are Calgary and Edmonton. I think they're literally a couple of hours away from each other. They had been fluoridated for many years. In 2011, the city council in Calgary decided to stop fluoridation. It was a very contentious decision, but they had received information from people saying fluoride can cause all of these terrible things, and in that very emotional circumstance made the decision to stop doing it. And then several years later, researchers from the University of Calgary did a study. They looked at children, same age group, in Calgary and Edmonton. So all during this time period, Edmonton's still fluoridated, but Calgary has stopped. And what they found really surprised them. The tooth decay rates in Calgary soared. There was an increase in Edmonton, but not anything on the order of what they were seeing in Calgary. And they had no reason to believe anything else was different, right? So it wasn't as though all the children in Calgary had stopped using fluoride toothpaste. The only real difference they could see was suddenly Calgary children didn't have access to fluoridated water. And so this has caused the city to begin having a debate. Maybe we should consider putting fluoride back in.
Now, I heard the number was 80%.
81% faster
okay.
rate of increase in Calgary.
So, I mean, to me, that's one that's pretty clear, and it was studied very carefully, and this wasn't... So, the other side of that, did more bad stuff happen in Edmonton since they kept the fluoride? More, lower IQ scores, any of that,
Yeah, there's been no evidence brought forward that would suggest that anything,
everybody in
cancer
Calgary's
or arthritis,
more
to
healthy
anything
now
else,
because...
it has happened in Edmonton, given that they have fluoride. So, we always look out for these kinds of things if there could be something going on, but we just, again and again, we don't see that. I think it's important to realize, too, back in the 1940s when we first started fluoridating in the United States, Grand Rapids, Michigan was the first community, the research that was done didn't just look at, well, let's see what's happening to tooth decay rates. Wow, they're dropping a lot. They also did exhaustive research on the children's medical conditions. They took x-rays, they took blood samples, they did a full physical exam because they were mindful of, hey, let's be sure that there's nothing unexpected happening on the medical side, that this is having any kind of adverse medical effect. And they looked at that very, very closely, and they didn't find any difference on that side. The only difference they found was tooth decay rates go way down when you have fluoride in the water.
So I've heard some other objections. Let me throw them to you. Well, if you have too much fluoride, then the teeth are going to get stained, and they're going to have fluorosis, is the name of the staining. So that's one. Second, well, let's go one at a time. So Talk about that one.
Fluorosis. So fluorosis is a change in the appearance of the tooth enamel, the opacity of it when light hits it. And what it actually does is there are very faint white splotches that can appear on the surface of teeth. Now, most people who have fluorosis on their teeth, they have no idea of it because it's so subtle. It usually takes a dentist or dental hygienist looking very closely within, a foot or even less to notice it. It doesn't, the kind of fluorosis we see in the United States doesn't affect the health or function of the teeth. It doesn't cause pain. It doesn't create any hardship in any other way. In fact, we've actually found that if teeth have mild fluorosis, they're even more resistant to tooth decay. So the challenge has been, let's find that balance, right? Let's try and find a point where fluorosis is either not existent or is very minimal. It's just a mild cosmetic issue while we're preventing the tooth decay. And that's what the public health community is really focused on trying to do.
So minor white staining on your teeth versus rotten teeth that put you in the ER, that are debilitating pain. To me, that's a no-brainer to me. But okay, another objection that I've heard. Well, it's medical treatment that you're throwing at me without my permission.
Yeah, that gets raised a lot, and I think what we have to realize is that there are various things added to water. Fluoride is simply one of them. We add chlorine to water because it helps to prevent E. coli. We add calcium hydroxide. Some add calcium hydroxide as a way to buffer to help reduce corrosion. It has no negative effect on children or adults. It's added to help make sure that the pipes do not corrode. It's a buffer. So this idea that fluoride is the only thing added to water is not really an accurate perception or portrayal. And I think the other thing to keep in mind is we have an awful lot of things that are added to our foods and beverages, whether it's adding vitamin D to milk, whether it's adding iodide to salt. We add folic acid by federal law to most breads and cereals. We do that to prevent disease from happening to children and adults. And I don't hear a lot of people saying, oh my gosh, I don't want folic acid in my loaf of bread. I don't want vitamin D in my milk. I think the people who tend to raise that really have other concerns, and that's sort of what they're expressing, but I'm not so sure the choice issue, if they really step back, is one that really applies to all areas of their lives.
Complaint number 3. Well, they used to fluoridate the water in Europe, and now they're dropping away from that in some places.
Yeah, well, that's a point you hear a lot, and it is true that most areas of Europe do not have fluoridated water. What you do see, though, is mass programs of one kind or another in Europe to provide fluoride to their people. I'll give you an example. Germany and Switzerland and France and Belgium have fluoridated salt that's on the market. It's widely sold. It is promoted through educational campaigns. It reaches most of the market in Switzerland. It reaches millions and millions in Germany. There are other programs that fluoridate milk. There are fluoride rinse programs that are much more highly funded in European schools than they are here in the U.S. And there are fluoridated water programs in several countries, not in all European countries, but they exist in Spain, they exist in almost all of Ireland, and they exist in England as well. The thing to keep in mind, I think, about that issue, because it does get misportrayed, is Europe's water systems predate the fluoridation era, and they were built at a time where to suddenly move to fluoridation would have required tremendous capital costs and changes, a lot of reliance on well water. Another thing to consider is there are a lot of areas of Italy where you have natural levels of fluoride that are at or close to optimal in central and southern Italy, areas near Napoli, for example. So drinking the tap water there without added fluoride means that you would be getting roughly the same amount of fluoride as optimal. There's also a bottled water culture over there that I think they recognize that water, for that reason, isn't as ideal a mechanism as maybe salt. Personally, I think salt is not an ideal approach because we know a lot of Americans, a lot of people around the world are on salt-restricted diets. So if you rely on that,
don't get too much sodium.
Yes, exactly.
Yeah. Okay, so let me ask you to make the kind of the broad sales pitch. Why this makes sense? Why this is something that what things maybe people are missing? Big picture.
Well, I think the thing to keep in mind is there is no silver bullet when it comes to helping children and adults stay healthy and grow up healthy. There are so many pieces to this puzzle. One is personal responsibility. We want people to brush their teeth regularly with fluoride toothpaste. That's just a proven way to do it. But we also recognize this is a little bit like trying to prevent a house fire, right? We have a responsibility. Don't play with matches. Tell your kids not to turn on the stove, not to do anything that could potentially raise the risk of a fire. But we also have a fire department. We also have smoke alarms. Smoke alarms are installed, and a lot of fire systems are set up before you open a business or open a home or apartment building. So we recognize there are things we have to do individually, but there are also some things we do as a community just to reduce risk and to help keep people safe and healthy. And so, to me, fluoridation fits very much in with that. You use fluoride toothpaste at home. Hopefully you're eating a healthy diet. You're not eating too much sugar or carbohydrates that fuels the decay process. But by putting fluoride in the water, especially given how many Americans don't have easy annual access to dental care, this is in many cases the only form of prevention they're receiving on a regular basis. So I think it's so critical.
Well, Matt, thanks for being with us.
Thanks, Dwayne.
We appreciate the advice.
Appreciate it.